Hello, I'm Takenya Hightower, and today I'm going to be discussing a time where I had to interprofessionally collaborate, as well as a time when an interprofessional collaboration could have been better approached. One of the most memorable collaborative experiences involved a case where the hospital quality department called a meeting reporting the high rates of nosocomial infections. The issue required a multidisciplinary team to address the various risk factors and implement interventions that would help reduce nosocomial infections. The change intervention team comprised of the charge nurse, the physician, the pharmacist, the infection control nurse, and all the staff nurses. The things that went well involved the identification of the potential risks with reports that we needed to change practices and integrate aseptic strategies when dealing with the patients. A training program was instituted and the finance team was involved along with the administrative representative as we moved to change the practice and introduce changes to oral hygiene practices, rounding practices, patient placement techniques, waste disposable changes, and sterilization and disinfection materials, as well as other programs. A time where interprofessional collaboration could have been better approached would be the Vila Health activity. And what happened in this scenario was a lack of coordination and leadership to guide the hospital during the change process as they adopted a new system. Some of the challenges and barriers to the effective collaboration noted included the lack of communication and team cohesion, since the management team failed to communicate with the other staff members and consulting them about the system requirements that could improve care. Additionally, the training staff failed to provide the necessary skills transfer regarding the use of the system due to the conflict with the IT department, which further failed to communicate effectively when addressing the concerns raised by the nurses. Nurses failed to collaborate due to the broken communication channels and the unethical practices that included failure to collaborate and assist, since one of the nurses seemed to have grasped the function of the system but was not willing to pass it on. The other challenges that served as a barrier to effective collaboration in the Vila Health was the lack of leadership demonstrated by Stephen, who was one of the corporate managers, who failed to engage the corporate side in advocating for better system and training programs after identifying the numerous barriers and challenges associated with the Helix. Additionally, Stephen and other leaders failed to act as leaders within the respective facility, since they did not undertake measures aimed at streamlining the change process when they failed to present their concerns with the department, and also since they failed to be responsible and accountable for their actions and emphasize on the measures that promote safety by ignoring issues that affected the health delivery. The lack of suitable program to help with the ongoing conflict is also an indicator of the poor leadership skills that cannot deal with the interdisciplinary conflicts and disputes. The leadership, both in the facility under Stephen, failed to create a favorable work environment, while the nurses and the other providers engaged in actions that would be considered incivility, while Chad Cook failed to promote discipline and work ethics among the IT department, tasked with the responsibility of helping other employees navigate the system-related to challenges. The negative implications with the lack of collaboration within the Vila Health included resource wastage that included financial resources required to acquire the system, the cost of having people train them effectively, and the costs associated with reduced productivity in the healthcare environment. Human resource implication included an unfavorable work environment, as nurses seemed to harbor hatred towards each other and blame seems to be manifested in the facility. Additionally, nurses who had to use the paper charting reduced productivity, and the time it took to have the system running also reduced productivity. Such concerns can affect the quality of care delivered, increase dissatisfaction, and hinder team collaboration in the future. Given the Vila Health situation, the leadership strategies that would best be suited for the organization to enhance collaboration and team activities are emotional intelligence and effective communication skills. Emotional intelligence refers to the ability to allow individuals to identify and manage their emotions and the emotions of others, thus creating an environment that is based on detached decision-making practices. According to Nagandi,